I'm Dr. Revathi Rajan, Chief Consultant, Maternal Fetal Medicine, as well as Managing Director of Mirror Health, which is a dedicated women's health center in Bengaluru, Karnataka, India. And I'm also the Secretary for the Society for the Maternal Fetal Medicine, India. Now, why this video? Well, as a responsible clinician, I presume that it is my responsibility to be talking about the common queries raised by my pregnant patients, as well as the do's and don'ts which they should probably follow during this pandemic. I'm not here to be talking about the numbers. I'm not here to be talking about the statistics to scare you, but anyway, to brief you about what this whole thing is about. We all know about certain facts. Right? This COVID-19 started off in December 2019, attributable to the novel coronavirus. The first case in India was reported on the 30th of Jan. WHO has called it a global pandemic on the 11th of March. Well, and how does this disease evolve? Well, it starts off as a very, very simple respiratory illness, and the incubation period ranges for about 5 to 14 days, and usually you become symptomatic after the 11th day, and only women who are, say, elderly, or I'm talking about the pregnant women, or immunocompromised, or in the general population, the elderly, are the ones who might go into the sick version of it, which is the acute respiratory distress syndrome, which could be fatal. But because considering that it is highly contagious, it is very, very important that we follow certain precautions and preventive measures, and most importantly, understand how we have to react appropriately to ward off this crisis effectively. So let's start with the rapid fire round, where I'm going to answer certain queries raised by my pregnant mothers. Well, let me start the questions. The first most important question is, what are the preventive as well as protective measures that these pregnant women should follow? And the first most important thing is social distancing. Stay at home and visit your clinic only if you are called for an at-risk surveillance, which your doctor will decide and communicate it to you. Otherwise, please stay at home. And the next important thing is also maintain a distance of 1 meter from any individual. Don't really go very close to any individual, because if somebody is suspected to have a cough or cold, this kind of infection can spread because of being closer to that person when he coughs or sneezes. And the next important measure that you have to follow is wash your hands, wash your hands, and wash your hands. Wash your hands very well. Use a soap and scrub it for at least 20 seconds very, very religiously. You may have seen a lot of videos. I'm really not going to put them. The take-home message is scrub every portion of your hands, including all your fingers, for about 20 seconds with either a common soap or an alcohol scrub. And don't unnecessarily touch your face, or also don't touch surfaces, unnecessarily, like tabletops or cupboard tops and things like that. And most importantly, follow respiratory hygiene. If you think you have a cough or a cold, wear a mask. Very, very important. And if you suddenly had to sneeze or cough, do it in a confined area. If you have a tissue, you can always cough it onto the tissue or discard it. Or else just hold your elbow so that you are protecting yourself against spreading the droplets or spilling the droplets everywhere. And if you've worn a mask, make sure that you dispose this mask effectively. Don't touch the insiders of the mask. Hold it along the threads and dispose it off in a proper designated area once in 6 to 8 hours. Well, coming to the next important query, what is this quarantine policy and how does this actually apply to pregnant women? Well, the quarantine policy as far as the pregnant women are concerned is not very, very different from the general population. Now, when do you quarantine a person? When a person has been probably suspected to have been exposed, or suspected to have had an activity where the person is in contact or has been in contact with a person who is known to have the disease but still not has not developed the disease. But isolation is different from being quarantined. Isolation is when you know that the person is already affected and you're trying to trying to prevent him from infecting other individuals, and you also want to supervise the natural progress of disease in him so that you can actually offer help whenever, step up help whenever it is indicated. Now, as far as the pregnant women is concerned, there can be a situation where a person who is a family member and who's living in the household as that of the same household as that of the pregnant woman has been quarantined, maybe because of travel or history of contact with a suspicious person to have had the COVID-19, etc., etc. So this woman has to make sure that she maintains adequate distance from the quarantined person, and very, very important that the quarantined person, whoever it may be, whether it's a pregnant woman or the person who has been quarantined and is not pregnant, should live in a properly ventilated room, restrict movements, make sure that he or she uses a very, very specified toilet, and if he or she is sharing the space with another quarantined person, try to maintain a distance of at least 1 meter. So this is very, very important, and also to wash clothes separately. So, and in case the quarantined person develops some exaggerated symptoms, which could be breathlessness or a feeling of exaggerated fatigue and very high fever, then contact your healthcare personnel immediately. So what I'm trying to tell is the quarantined person can either be the pregnant woman, or the pregnant woman may be in a household where another person is quarantined. So the quarantine policy is the same, follow the rules, as per the general population, which is briefly what I summarized just now. The third important question which comes or runs through the minds of these pregnant women is, how do we test and when do we test these pregnant women? Well, not everyone needs to be tested. The testing policy is same like in the general population. So if you've had history of contact with a person who is known to have had COVID-19, or you are a healthcare worker who is exposed to COVID-19, or a pregnant woman is exposed to a healthcare worker who's again exposed to COVID-19, or who's had a suspicious travel, making that person exposed to a person who is already diseased, then is where you will have to test this pregnant woman. Well, testing is actually done, earlier it was done only in government registered or recognized centers. Now we thank the government of India for liberalizing it. We have about 22 centers, or I presume there are quite a few private centers. I'm not really sure about the exact numbers right now. So where testing can be done, but these need to be licensed by the government of India. And what they follow is, like, the testings are of two kinds. One is the RT-PCR, and where you use the reverse transcriptase polymerase chain reaction method, which helps in identifying the COVID-19 positive patients, and this is usually done on a nasopharyngeal swab, just like how we collected other viral infections like the H1N1. And most importantly, this test is what is being used right now. The cost of this test is about somewhere in the range of 4,000 to 5,000 in Indian rupees, and we assume most of the times the report is got within a day. So you test today, you get the results by tomorrow. But one of the important drawbacks of doing this particular test is that it's got a high false negative rate. So serial testings may be required. It could have a false negative rate of about 10 to 20%. So and this test becomes negative after about 3 weeks of the infection. So if you really want to pick up all cases, better to do serological tests, which are being promoted now, and but we still have to work on this, where we can actually use serological tests to identify the cases. Well, after having spoken about testing as well as the quarantine policy, if you're looking at the next important question is about the transplacental spread. Well, most of these women ask us, suppose we catch this COVID-19, is my fetus at risk of getting this too? Well, from the literature that we have, and most of it which has been coming out from China, we have really not found any evidence that this can pass from the mother to the baby vertically. But what we've understood is most of these women have had a higher incidence of preterm births. So there is no direct evidence to suggest that there is a transplacental spread from the mother to the fetus. Well, good afternoon. Continuing my rapid fire on the COVID-19 questions which have been posed by my pregnant mothers. The next question is consultation and surveillance, whom and when. According to recommendations, it is better that pregnant women can consult with their doctors through a video conferencing portal unless and until their presence is physically required for a particular scan or maybe for any kind of medical emergency where that patient has to be evaluated by the clinician. There could be situations where a mother has a sick fetus, who's growth restricted, and a particular scan needs to be done to decide delivery and things like that. So in those situations, we would still schedule an at-risk surveillance appointment. Otherwise, restrict your movement to the clinic, and you could always talk to your clinician on a video conferencing portal, so that the clinician also is able to analyze or to look at you, so that the exact clinical condition of the patient could be assessed to some extent, at least the general well-being. The next important question is criteria for hospitalization and critical care surveillance. So as per the ICMR guidelines, any person who is tested COVID-19 positive needs to be hospitalized and isolated. Other than that, any pregnant mother who has a chest x-ray features of pneumonia or needs to be admitted. I feel it's very prudent that we watch her for further progression of symptoms, and also if needed test her also, looking at the history and the background. And as far as critical care surveillance, any pregnant mother who worsens from the respiratory perspective, that is, develops features of acute respiratory distress syndrome when there is a hurried breathing, where the respiratory rate is more than 22, when there is high-grade fever with chills, or when there is an altered sensorium, etc. It becomes, or when there is hypotension, that is when the mother feels giddy and the BP, the systolic blood pressure, is less than 100. So these are the women who require critical care surveillance. Having told you about who requires surveillance and how to do the consultations and where we have to look at critical care surveillance, the next important question that arises in the minds of the pregnant women is, are there any guidelines for treatment? Yes, we've been actually reading, getting information that there have been some small studies which have looked at the anti-malarial hydroxychloroquine. What is actually seen in most of these studies is when a person is tested positive, if this person is given hydroxychloroquine 200 milligrams thrice daily, usually after meals, along with azithromycin 500 milligrams once a day. This is for about 10 days. And what is seen in literature, or what is seen as a outcome of these studies, is that at the end of 6 days, most of these patients have turned 100% test negative. So there have been several protocols, there have been different ways of using hydroxychloroquine, which is still being looked at. And there have also been recommendations on antiretroviral therapy, but that is very expensive, and we've still not been making it as a recommendation. It still has to be explored. What about the care? How do we actually monitor patients in labor, delivery, as well as how do we monitor the newborns? That's the next important question. See, if you're looking at labor and delivery, the indications to decide on labor and delivery does not depend on COVID-19. You don't have to deliver a person just because she's COVID-19 positive. That is something that you'll have to understand. But what you have to know is if somebody gets into labor, then you will have to, it's better to always schedule a delivery. That means you call the patient a little early, when she's just, started to have symptoms that she would progress into, she would go into full-fledged labor. So call them a little early, keep a room which is, designated for delivery, and make sure that you deliver every patient as if she is COVID-19 positive. Make sure that you restrict movement of healthcare personnel. So you have a doctor and a nurse who's taking care of this patient, and maybe an anesthesiologist who's trying to give anesthesia if required. It could be a normal delivery or a cesarean, or a normal delivery turning into a cesarean, but very, very important that you limit the number of healthcare personnel that is required, and also limit the number of attendants. Be very, very clear about it. You don't really require too many people to be inside the room, and necessarily what is important, that all of these healthcare personnel also wear personal protection equipment, because we never know, because we've had instances where people have tested positive after the delivery, so we don't really have to take the risk. As far as a newborn is concerned, you usually want to order a test if a baby is born of a COVID-19 positive pregnant mother within 14 days of the infection, or if the newborn has by any chance been in contact with a person, maybe a healthcare professional who has turned positive. That kind of a scenario, you would want to test the newborn. And as far as breastfeeding is concerned, generally there are no recommendations which strictly tell you that you will have to avoid breastfeeding in these newborns, because the advantages of breastfeeding the neonate is much higher than the risks that are actually involved. But yes, you will have to explain to the patient, saying that the patient has to take the necessary precautions. She has to wash her hands, and also make sure that the proximity of the neonate is a question. But yes, obviously the hygiene matters quite a bit. With all this, I think breastfeeding can be allowed. And with this, I think most of the queries regarding the COVID-19 and its effect on pregnancy is answered. I would also want to address some of the common queries regarding disinfection and masks, etc. in the next segment. This segment is to look at the disinfection perspective. It's very, very important that we know how to disinfect surfaces. Most importantly, alcohol and chlorine based disinfectants have been tried, and sodium hypochlorite does an excellent job. The home bleach that we usually call, which contains about 5 to 6% of sodium hypochlorite. If you're looking at the disinfection of the medical equipment, one is if you have any biological waste which needs to be discarded, this needs to be first treated with sodium hypochlorite, ideally for about say 30 minutes, and then you can discard it. Even the linen that has been used or soiled, first it has to be treated with sodium chloride and then only processed the way it should. As well as the air is concerned, it can be fumigated. And if you're looking at the tabletops as well as the handles and these kinds of surfaces, it's very important that you clean it, and most of the times it's usually the chlorine as well as the sodium hypochlorite solutions that can be used. And if you're looking at the floors, better to clean it at least twice to 2 to 3 times a day with these kinds of liquids. Now there are certain myths, we've actually encountered, some of my pregnant women have told me that, the policemen are holding their relatives because they're not wearing a mask. What you should understand is it's not compulsory to wear a mask every time.
But what is important is if you have an upper respiratory tract infection, it's always better to, if you have a cough or a sneeze, it's always better to wear a mask. Or if you are treating a COVID-19 patient, it is important that you wear a mask. Or if you have a patient who has, if you are a healthcare worker and you're treating a patient who has a bad cough and cold, then it's important that you protect yourself with a mask. So these are the absolute recommendations. So otherwise you don't really have to wear a mask if you're very sure about your environment. But these situations warrant the use of a mask. Well, I come to an end of this recording, and what we've done is we haven't done this recording on a single day. We've done it, over a period. That is because we've collected questions. The questions that I'm holding here. We've collected the questions and queries that have come out of pregnant women who've been and their attenders who've been asking us, and we've integrated all of these and we've tried to make it comprehensive. So we've done it at different times and trying to put all of them together. So the saga does not end. There can be new updates about the COVID-19 and pregnancy. We would definitely want to do that in the next recording. So stay safe, stay connected, try to take all the precautions that I have told you, and get in touch with your doctor, not necessarily physically, but always you could do that digitally too. So until next time, bye from here.